You know, it's pretty wild to think that almost every single one of us will get infected with the Epstein Barr virus, or EBV, at some point in our lives. You've probably heard of it by its more famous nickname, but it turns out that's really just the tip of the iceberg of a much, much more complicated story.
So, when you hear the kissing disease, your mind probably jumps straight to mono, right? You picture a rough couple of weeks, maybe in high school or college, a nasty fever, serious fatigue, and then it's over. But what if I told you that's not the whole story? Honestly, it's not even close.
All right, so let's start with what we all think we know. We're talking about infectious mononucleosis, or as some people call it, glandular fever. This is the classic way EBV shows up, especially when it hits you as a teenager or young adult.
And mono, well, it's a full-body fight. It usually kicks off with a high fever and just an absolutely brutal sore throat, plus those classic swollen glands in your neck. But the symptom that really defines it is that crushing fatigue. I mean, it can stick around for weeks, sometimes even months, and in a few cases, people might even get a rash or a touch of jaundice.
Now get this, in half of all mono cases, the spleen actually gets enlarged. 50%. That's why doctors are so incredibly strict about no contact sports during recovery, because a ruptured spleen is a life-threatening emergency. It's a really stark reminder of just how hard your body is working to fight this thing off.
And here's a strange little medical twist for you. Mono can look a lot like strep throat, which is bacterial. But if a doctor makes a mistake and prescribes certain antibiotics, like ampicillin, for what's actually the EBV virus, it can trigger this massive head-to-toe rash. For doctors, seeing that rash is a dead giveaway that they're dealing with mono, not strep.
Okay, so once you finally feel better and you've recovered from mono, the virus is gone, right? Wrong. And this is where the story gets really interesting. You see, EBV isn't just some temporary visitor. It moves in and becomes a permanent resident in your body.
This happens because of something called viral latency. EBV is a type of herpes virus, and they all share this incredibly clever trick. After your immune system wins that first big fight, the virus doesn't actually get cleared out. No, it just retreats into some of your cells, goes dormant, and basically hides out for the rest of your life. So this gives the virus two completely different phases. You've got the active phase, that's mono. The virus is copying itself, you feel sick, and yeah, you're contagious. But then there's the latent state. Think of it like a sleeper agent, lying dormant inside your cells, not causing any trouble. The catch, of course, is that agent can be woken up later on. And this is where that whole lifelong guest thing takes a much darker turn. Because under certain circumstances, that dormant virus waking up isn't just a nuisance, it's actually linked to the development of several types of cancer. And let me be clear, we're not talking about some minor association here. EBV is recognized as a direct factor in these cancers. For instance, Burkitt lymphoma. It's one of the most common childhood cancers in parts of Africa, and pretty much every single patient also has an EBV infection. The virus is also directly, causally linked to cancers of the throat and the lymphatic system, like Hodgkin lymphoma.
This brings us to another really critical piece of the puzzle, how EBV behaves totally changes when a person's immune system isn't at 100%. For most of us, our immune system does a great job of keeping that latent virus in check. But what happens when it can't?
Well, for some people, it creates this incredibly dangerous chain of events. An individual with a certain genetic immunodeficiency just can't mount a normal defense against EBV. So for them, an infection that would just be a bad case of mono for someone else becomes this overwhelming, sometimes even fatal illness, or it can lead directly to lymphoma. So when you start putting all these different pieces together, you get a completely new and, frankly, startling picture of this virus. It's so much more complex than just the kissing disease we all started with. So let's just recap. There are really 4 key truths you need to know about EBV. 1. Yes, it causes the kissing disease. 2. It's a herpes virus that literally stays with you for life. 3. It is a known trigger for several human cancers. And 4. For anyone with a weakened immune system, it can be an absolutely profound threat.
Ultimately, I think the best way to describe EBV is with this phrase: a multifaceted pathogen with implications far beyond a simple self-limiting viral illness. It's a lifelong companion that is just far more complex and potentially far more dangerous than most of us ever realized. And all of this, it leads to one final kind of haunting question. We all carry viruses that have taken up permanent residence inside of us. So if this is the hidden story of just one of them, What other secrets are our lifelong viral companions hiding?